Good afternoon, everyone, and thank you for being here today. My name is Kirsten Johnson, and I am the Secretary for the Wisconsin Department of Health Services. I'm excited to kick off our first webinar to provide an overview of DHS's budget. With us today is H.J. Waka, our Legislative Director, Jamie Kuhn, Medicaid Director, Ginger Steele, Division of Care and Treatment Services Administrator, Andy Forsyth, DHS Budget Director, and Karen Odegaard, our External Affairs Liaison. Governor Evers' 2023 to 2025 breakthrough budget for DHS leverages Wisconsin's unprecedented surplus to make substantial investments in Wisconsin's healthcare, behavioral health, public health, and long-term care systems, as well as initiatives to advance equity and reduce disparities in our state. For our partners joining us today, we are so appreciative of your support to ensure this budget makes Wisconsin healthier. Thank you for the tremendous amount of work you do every day to protect and promote the safety and health of Wisconsinites in your communities. Every Wisconsinite and every community deserves the resources provided in this budget to invest in our working families and to drive economic growth. Good health is essential for everyone, and Governor Evers is dedicated to preserving and protecting the health of Wisconsinites throughout the state. Before we go into details of what's in the budget to support these initiatives, I will turn things over to H.J. Waka, our Legislative Director, to talk more about the budget process. H.J.
And thank you, Secretary Johnson, and good afternoon, everybody. Before I dive into the budget process, I just want to let you all know that if you didn't see a little thing pop up when we started this, that today's webinar is being recorded, and we will provide a link to the recording and slides to the presentation today for those who registered. Please use the question box to ask a question during today's webinar, and we'll leave time for questions at the end. We might not be able to make all of your questions or answer all of your questions today, but we will be sure to follow up with each one of you after the fact if that is not possible. So now that we've got that out of the way, I want to provide you all with a high-level overview of the state budget process, kind of where we're at and where things are going to go from there. Next slide, please. And I just love the animations of it all showing it come together. So I'm very much a believer in the fact that the state budget process never really ends. As soon as one budget process wraps up, one cycle, the whole thing starts new again. So that beginning point would be at the red arrow at the top of the circle that you're seeing right there. And where we are right now is at the little yellow arrow at the bottom of the circle, and that's kind of where the meat hits where you start getting the meat on the bones for the budget. So we've already been through the process where the agencies have submitted their budgets. That happened in September of last year. Those then go to the governor's office and then over to the state budget office for review, and then are formally introduced earlier this year. And now we're into, like I said, this little yellow arrow at the bottom of the cycle. And that's where we want to start going forward. And this is where we want to start to engage with all of you on this process. Next slide. So for those of you who aren't familiar, right now I said we're in the point where the Fiscal Bureau has begun preparing its summary of the governor's budget. That happened and that was put out last week. And then we start going forward from there. Joint Finance has already issued its hearings or already selected the agencies that it wants to have in coming into a budget hearing. And then they're going to start holding those public hearings, and then they're going to start doing their what is called the quote-unquote roadshow, where members of Joint Finance go to all the different areas of the state to hear information and public and feedback from the public. So that'll start here in about the next couple of weeks. After that, in early May is when LFB will release the general fund updates. And then starting from May through early June is when we start seeing the executive sessions from Joint Finance, at which point they'll then vote the bill out of committee and then onto the floor, and then it'll be signed, hopefully, fingers crossed, late June, early July. Next slide, please. And for those who want to know where they're taking the roadshow for Joint Finance, as I said, they're going all over the state. So they're going to Waukesha, Eau Claire, the Dells, and Minocqua. We just started getting today the updates on where exactly those locations will be held across the state. So if you have any information or have any questions about where to go find that information, please click on the link in the slide. And again, we'll make sure that you have the slide so you can see and stay up to date on that information. Next slide, please. And one of the biggest things that we want to ask from all of you, for those who are taking the time out of this day to listen to us and to hear what's in the budget is we really want to help you engage and to help support you to help advance the initiatives that you like that are in the governor's budget, and to help move these items forward so that they can make it all the way from the governor's budget through the signed version at the end of this year, hopefully in early July. And we want to help you support your community by identifying budget priorities that align with your services and your proposals that help improve the health and well-being, health and wellness of your community, helping you get the message out. We want to be able to provide resources to you. Again, we have a lot of this information already on our site. If you don't have that information, we are more than happy to get that to you. And please feel free to use that information as you will to help further support and bolster that message. Really want you to help champion these initiatives. Again, each one of these initiatives, all 127 of them, are great, are important, and things that we need to improve the health and the people of Wisconsin, as well as to stay informed. And again, we'll be continually and constantly updating our budget website with white papers, backgrounders, and all sorts of information that you can take for your folks and for your advocacy for the initiatives that are in the governor's budget. And with that, I will turn it over to Jamie Kuhn, our Medicaid director.
Thanks, HJ. As you all know, healthcare is a cornerstone of workforce and economic development in all communities across the state. And Governor Evers' budget makes critical investments to support working families and address long-standing workforce needs to drive our economic growth. Overall, the Department of Health Services budget is over $17 billion annually. The DHS budget includes key initiatives, expanding Medicaid coverage, building healthy communities, improving mental health and crisis services, investing in our long-term care, and addressing staffing and workforce needs across the health sectors. The budget proposal for the Department of Health Services is once again anchored by Medicaid expansion, which would expand high-quality, low-cost Medicaid coverage to Wisconsinites with incomes up to 138% of the federal poverty level. Expanding access to quality healthcare services ensures that everyone has the ability to receive preventative healthcare services and can adequately treat illnesses or emergencies. As of January 2023, Wisconsin is one of only 11 states that have not chosen to expand their Medicaid programs. States that have expanded Medicaid have experienced positive outcomes as more people gain access to needed treatment and care, hospitals stay open, and jobs and the economy grow. This budget proposal is also good for Wisconsin's workforce by increasing the number of people who can find and maintain full-time employment and helps prevent medical bankruptcies. The significant savings from Medicaid expansion allows the governor's budget to expand the benefits available to members through the Medicaid program to better meet their needs. Medicaid expansion savings will be used for improving public health, strengthening behavioral health, investing in long-term care, and making health insurance and prescription drugs more affordable. Expanding Medicaid is good for our health, and it is good for our workforce. And if you'd like to learn more, we'll be hosting a focused budget briefing highlighting Medicaid expansion at 10 a.m. on April 3rd. And a link to register for that is in the chat. Public health activities also lay the groundwork for healthy communities. They protect us from disease and injury, and we cannot prevent alone, and help us change behaviors harmful to our health. Compared to the rest of the nation, Wisconsin has been significantly underfunded in its public health efforts for years. Recognizing this fact and the importance of a strong public health system to protect and promote the health of all Wisconsinites, the governor's budget makes Wisconsin's largest GPR public health investment to date. This includes investments that improve maternal and infant health, boost emergency medical services, invest in public health, and support older, vulnerable residents, limited English speakers, and their service providers. If you'd like to learn more, we will be hosting a focused budget briefing highlighting this portion of the governor's budget at 1 p.m. on March 30th. Again, there is a link to register for that in the chat. And now I'll hand things over to Ginger Steele, Division of Care and Treatment Services Administrator, to talk more about the mental health initiatives part of the budget.
Thanks, Jamie. The past few years have been really tough on all Wisconsinites, and according to the latest Youth Risk Behavior Survey from the CDC, 42% of high school students experience persistent feelings of sadness and hopelessness. They also released data last month that shows 50% of US teen girls felt persistently sad or hopeless in 2021. This is double the rate of boys and represents a nearly 60% increase and the highest level reported over the past decade. The report also confirms ongoing and extreme distress among teens who identify as LGBTQ+. And we know it's not just our children who are in need of care. There are millions of adults in the US affected by mental health concerns each year. Based on 2020 data from the National Alliance on Mental Health, 1 in 5 adults in the US experience mental health conditions each year. Governor Evers' budget recognizes that behavioral health is essential to overall wellness. And Governor Evers declared 2023 the year of mental health, and his budget builds upon that declaration by making significant investments in expanding the availability of behavioral health services so that Wisconsinites can receive care closer to home. This includes investments in improved crisis response and support for youth crisis stabilization facilities. Also includes investing in mental health by continuing funding peer recovery centers and expansion, offering culturally and linguistically affirmative behavioral health services to those who are deaf, hard of hearing, or deaf-blind. It also includes improving accessibility and affordability of receiving critical mental and behavioral health care, as well as utilizing marijuana excise tax to support behavioral health services. And lastly, investing in mental health services in schools. Funding suicide prevention efforts, it will also support these efforts, such as expanding staffing and resources for Wisconsin's 988 Suicide and Crisis Lifeline services and establishing a suicide prevention program. It will also include expanding substance use disorder services that also include developing integrated behavioral health stabilization, intoxication monitoring, and detox facilities, supporting addiction prevention and treatment responses, and ensuring accessibility of needed residential substance use services. If you'd like to learn more, we'll be hosting a focused budget briefing highlighted this portion of Governor Evers' 2023-2025 DHS budget at 1 p.m. tomorrow, which is March 21st, and a link will be included in the chat. Looks like just put in there. Next slide, thank you. The long-term care industry has been impacted by the COVID-19 pandemic and is facing numerous challenges from staffing to financial sustainability. This budget makes investments to bolster, stabilize, and support long-term care providers across the state. These investments include continuing home and community-based services. These services help older adults who have disabilities that live independently in their community by providing help with tasks like getting in and out of bed, personal hygiene, preparing meals, and getting dressed. It also includes developing a complex patient pilot, which aims to address difficulties and delays experienced in placing individuals with medical challenges in post-acute care settings. It includes increasing aging and disability resource center funding, that's ADRC funding, to keep up with increased demand, as well as investing in the long-term care workforce and expanding the Alzheimer's Family and Caregiver Support Program. Next slide, please. Governor Evers' budget also makes significant investments to address workforce shortages experienced by every sector of Wisconsin's economy. This budget builds upon investments made during the COVID-19 pandemic using federal ARPA funds to support talent development and policy changes to get and keep skilled workers in the Wisconsin economy. Wisconsin healthcare workforce challenges were exacerbated by the pandemic, and the budget invests in long-term solutions to promote staffing across all healthcare sectors. And those investments include workforce initiatives such as continuing support of the WISC Caregiver Careers Program. This program aims to address the shortage of certified nursing assistants in the state by supporting recruitment, training, and retention of qualified caregivers for nursing home residents across Wisconsin. It also includes healthcare provider innovation grants, healthcare and public health innovation grants, and healthcare long-term care provider quality assurance by addressing workload demands for quality oversight for long-term care services. DHS manages and supports 7 care and treatment facilities for people living with psychiatric disorders and intellectual disabilities. And the budget invests in staffing for these DHS direct care facilities by expanding capacity and fully staffing MJTC or the Mendota Juvenile Treatment Center, transferring security personnel at WRC or Wisconsin Resource Center to DHS. So security staff at the Wisconsin Resource Center are currently administered by both the Department of Corrections and DHS. And this introduces needless complexity and challenges to human resource administration in both organizations. And that's the reason for this request. And then the other request is expanding the intensive treatment program at the Northern Wisconsin Center. The Northern Wisconsin Center serves people with intellectual disabilities and currently has the capacity to expand the program. If you'd like to learn more, we'll be hosting a focused budget briefing highlighting both long-term care and staffing and workforce investments. This will be at 1 p.m. on April 3rd, and a link to register will be dropped in the chat. I will now turn it over to Karen.
Thank you so much, Ginger. Wanted to just walk through where you can find more information in addition to the budget briefings that we've been sharing with you in the chat. As we noted that we did record this webinar, so we'll be providing that to folks who have registered. And we'll also be recommending folks to visit our website and stay in touch with our website to learn more about the budget there. You can dig into any of these topics in more detail on our site. So with that, I'd like to open the floor to share what questions you have. You can go ahead and use the question box to ask your question, and we'll do our very best to answer as many as we can. And then while we wait for some questions to come in, I did want to just take a moment to reiterate some of the ways that you all can get involved in the budget process. HJ went through these at the beginning, and I think just as we close the main content of what our budget proposals, our budget includes, we want to reiterate that you can get involved by supporting your community, by reviewing what we've shared here today and identifying the budget priorities that align with your services, and then which proposals will help improve the health and wellness of your community. You can get involved by helping to get the message out, sharing and educating members of your community on the budget proposals and providing updates on the budget process. You can champion the budget by identifying those priorities that really make the most impact to you and your community and engaging in the budget process to support those. And then we would encourage you to stay informed. Again, you can follow updates or learn more on our website, and you can also track updates and other information related to the budget by following the Joint Committee on Finance along with our website. We're going to move to the next slide, and we'll continue to hold some space for questions if folks have them, but I did want to just reiterate some of the ways, again, that you can be learning more about the budget. Our website will be dropping that in the chat, and we will continue to build out that website with additional resources throughout this process. As a reminder, we'll be hosting those focused budget briefings that we've been sharing with you throughout today's webinar over the next few weeks, and we welcome you to join us for any of the topics that are of interest to you and your networks. I know we've been dropping those into the chat as we've been going, but we're going to put them all in at once here so that you can grab the ones that are of most interest to you. And I am not seeing any questions, so why don't we go ahead and we'll bring this webinar to a close. We'll just go to our very last slide. And I do want to take a moment here to thank Secretary Johnson and our presenters today, H.J. Walka, Jamie Kuhn, and Ginger Steele, for walking us through a brief overview of the DHS budget. I also want to thank you for taking time to be here today and for all that you do to protect and promote the safety and health of Wisconsinites in your communities. We really appreciate your time, your work, and your willingness to engage in the budget process. Thank you so much for your time today, and have a great afternoon.